No, you do it. No.
Yeah.
Shall I start, sir?
Yes, sir. Please, sir. Please, sir. Please, sir.
Yes. Very good morning to all of you. I'm very, very grateful to RYB team, Brahmanji, for giving me this opportunity. So I am Professor Dr. V. Muralidhara, orthopedic surgeon, practicing past 22 years in a place by name Tumkur. It is about 70 kilometers to Bangalore, Karnataka. So I'm very, very happy to receive any questions related to orthopedics or in general health also, doesn't matter. So today is in question and answer session. So if any question, any doubt, anything regarding orthopedics from you or your family, friends is okay. If not, any general health questions also is okay for me. I'm ready to answer whatever I know. Any specific questions?
Yeah, can I?
Please, ma'am.
Okay, so my question is that with respect to joints, how do we take care of our joints for, see, all of us are aging, we are not getting any younger.
Yeah.
We do exercise, yes. But then the thing is that joints, if we are taken care of, I think, a lot in our bodies then taken care of, especially the knees. The knees, many people, and even I at times, I feel so. So what is the remedy for taking care of the joints is my question to you.
Yes, madam. So basically, as you told, knee joint is a weight-bearing joint. It is the largest joint in the body, and then comes the joint which has largest surface in the body is knee joint. So that's the main weight-bearing joint. So being the weight-bearing joint, there will be a lot of load that is put on the knee joint. So naturally, whenever we are standing for long duration, doing jogging or any such activities where the load is put on the knee joint, let's go for wear and tear, right? What happens in young age, there is a lot of regeneration occurring. Whatever the amount of degeneration which occurs, same amount of more than that regeneration occurs. So in young age, doesn't matter if you do any kind of gymnastic or you climb mountains, you do long jump, high jump, whatever the degeneration occurs, it will regenerate in younger age group. But what happens as the age advances, so the regenerating capacity of the body is not happening to the same extent what the degeneration happens, right? So as any vehicle, right, any way, four-wheeler, two-wheeler, whenever we overuse it, the tire goes for wear and tear and it will get attrition. So similar things happens in human body also, especially knee joint being the weight-bearing joint. So knee and hip joint are the two joints which are go for osteoarthritis. That is a degeneration of the joint. So what we can do is, if you have a positive family history or family members like your father, mother, or any sisters of yours are suffering from any knee osteoarthritis, any history of suffering from knee pain, that's the aging process, that's osteoarthritis. So you have to be a bit precautious. What the precautions that you can take is, one is you can reduce your body weight. So any extra weight that you are carrying, let it be 1, 2, 3 kgs also, no? You are putting that weight each and every minute on your knee joint whenever you're standing, walking, or climbing the stairs. So in a nutshell, it becomes very much huge load on the knee joint. So keep your body weight in control as a one thing. Second thing, do some exercise to strengthen your quadriceps muscles. Quadriceps muscles is a muscle which is the thigh muscle basically. It's called as quadriceps because it has 4 heads in it. So that's called as powerhouse of the thigh. So that is a muscle which takes a lot of whatever the activities, stress and strain and body weight, everything will be taken, load will be taken by that particular muscle, quadriceps muscle. So if you do some exercise, what we call as quadriceps drill, so strengthen the quadriceps muscle, right? So if your quadriceps muscle is strengthened, so whatever the activities that you're going to do in day-to-day activities, the load will be taken by the muscle itself. So what happens, the stress and strain on knee joint will reduce. That's the second thing, right? So third thing, don't do anything which hurts your knee. Like, say up to certain age, it's okay. Once you have crossed 50 or 55, 60, whatever it is, any activities which hurts your knee joint, like standing for long duration, then jogging, then skipping, any of such activities wherein the knee joint is going to face a lot of stress. Those activities better to be avoided. What we say is, whenever you have a choice to avoid straining the knee joint, you avoid straining the knee joint so that knee joint doesn't get the maximum brunt of day-to-day activities. That's the thing. And fourth one is, you should take the food which is rich in calcium. That will also take care of your bone joint, your joint health. And also certain medication is also there to strengthen the cartilage surface, like chondroitin sulfatase, glucan sulfatase. There are so many other things are available wherein that will help in the regeneration of the cartilage surface. So that needs to be taken only if you have suspected osteoarthritis of the knee in the early stages. So these are some of the things you can follow in the day-to-day activity so that your knee joint is taken care of. Not only knee joint, any other joint will be taken care of. That's the thing, madam. That's the basic precautions that you can take.
So you said to avoid skipping, is it?
Skipping, yes. As long as your knee is not hurting, if you are comfortable, you go ahead. See, there are some patients, even who are like as young as 30 plus, they have got their knee problems. So those patients, we definitely ask them to not to go for skipping, jogging, all those things. There are some patients who are 55, 60, they're quite happy, they're doing it. See, there are it's a multifactorial thing, like your genes, your count, your genes will count, your food, your habits of day-to-day activities will count, your body weight will count. So many things are there, right? So once the pain, if you start getting the pain in your knee joint, if it says it cannot take any more load, that is the time you should avoid all these things. There are some patients who, at the age of 30 years, they get these symptoms. We ask them to avoid all those things. There are some patients who are 60, they are doing happily, jogging, everything, they are comfortable, no problem. Then they can continue. So it depends. As long as they've got good joint, they've got good genes behind backing up them, then it's fine. If they have got started taking symptoms, then better they reduce it. Like that. Suppose, let me tell you.
The only symptom. So pain is the only symptom. Discomfort. Yeah. I mean, discomfort is the only
discomfort, pain, and any swelling. So knee joint will start crying, it will cry in the form of pain or producing swellings, all those things. So if any symptoms are there, then that's the time you should decide that, okay, my knee joint is not good enough to take this amount of load. Let me reduce the load. It's like that. Yeah.
Thank you.
Yeah. It's like, suppose there are some people who eat good lot of seeds and all those things, still their weight is maintained. So if they're happy with their weight, if it's a normal weight, let them eat. But once they have started obesity and their weight is beyond their usual scientifically given thing, then better to control the eating habits. It's like that. Yeah.
So one question, is there any periodic check of health, like bone health? Is there any such checks required? I mean, like once you feel the pain, I think probably you know that maybe something has started. Is there any prevention, like I think you were mentioning about osteoporosis or bone density or something. Is it required to take that periodically, or maybe it's based on the...
Yes, sir. Got that question. Yeah. There's one test called as BMD test. That's bone mineral density test, which we recommend after the age of 50 years. After the age of 50 years. So especially that is the age where the maximum bone strength starts loosening. Actually, I've got good chart and all. I will share in the WhatsApp. The chart will speak of itself. See what happens now if you take this is the curve. What happens in the suppose I will share that chart later. Suppose if it is your 0 age, as the age advances, your bone strength keeps on increasing like this. So at the age of 30, you have maximum strength. If this is the curve, at the age of 30, you have maximum strength. 30 to 40, there is slow loss of bone. But once you reach 50, there's steep fall like this. There's a steep fall in the density of the bone. So at the age of 50, we say that you better get done the bone mineral density test and find out what is the real density, what is the amount of calcium or the strength of the bone that you are having. So if it shows markedly low, then you better to start with some calcium supplementation, then vitamin D, then doing some exercise regularly. All those things are definitely recommended. So that is recommended after the age of 50 years only. Yes, sir. There's a test actually called as BMD test that will show you the bone mineral density, whether it's osteopenia, osteoporosis. There are a lot of scores, -1, -2, -0.3, and all those things.
Yeah, you please write down the name of the test in the group.
Okay, madam. I'll put it in our WhatsApp group, right?
Thank you. Yeah.
But all the details, photos, how the osteoporotic bones will look, how the normal bone will look, what are the histopathological features, everything is there. I will just share that in my WhatsApp, in our RYB group, WhatsApp group. And I have created one video also to explain how the density decreases, what happens, all those things. It's there beautifully. I will just post it there, right? Yeah.
Okay.
Is any other question?
Just one more question, sir. Is there any side effect if you take more calcium? I mean, you should be watchful about the quantity, because sometimes it might be on the lower side majority of times.
Yeah, I got your point. See, any overdosage is bad. That's for sure. Any vitamins, we call it hypervitamins. We take excess of vitamins. It's of no use. It will just go in the urine. There are some symptoms called hypervitaminosis. Hypo means less, hyper means excess. So anything in excess can cause problem once again. So calcium also shouldn't be taken in excess. Unnecessarily shouldn't be taken. That's why, especially it is indicated whenever that's like when in adolescents, when there is growth spurt is there, that's the time we need extra calcium. There we recommend extra dose of calcium. Then patient when pregnant is there or whenever they're lactating, that's the time when we need extra calcium. That time we recommend extra calcium. Then after the age of 50 years, once they are when the body doesn't have the capacity to absorb the calcium from the food, or when its capacity to digest and create calcium and retain in the body is decreased, so we have to give the more doses so that that will get compensated. So during those situations only, high demand situations, we recommend extra calcium. Routinely, you need not take it, because whatever the food you take in the normal, like your milk and milk products, then your green leaf vegetables, all those products have good rich in calcium. Like ragi is the richest of calcium. So whatever there in the food, that itself in a normal routine people, whenever there's extra demand only, we need to take extra. So otherwise, routinely you shouldn't take extra calcium. Say about that when you are between 30 to 50, there's not much need of extra calcium as such, tablets as such. Yeah, that's the thing. Okay. And if you take extra, there are some conditions like people who are predisposed for having kidney stones, right? So there are some people.
Yeah, I had that, Muralidhara. I had kidney stones. So after the kidney stones were removed, they tested it. It was calcium, excess deposit of calcium.
Exactly, madam. So there are some people where their body mechanism is that excess of calcium is excreted to the urine. There are some mechanisms in the body. So those patients who are more prone for kidney stones, they need to be a bit careful while consuming extra calcium. So not all people will get all people who are taking calcium tablets won't get the kidney stones. There are some category of, all patients won't get kidney stones. There are some who get the kidney stones. There are some people who don't get the kidney stones. So those patients who are more prone to get the kidney stones, those are the patients who need to be a bit cautious while taking calcium tablets in excess. Those patients. Routinely, most of them can take after 50 years. Usually it doesn't cause any problem as such. Yeah. And body has got beautiful mechanism. It will store whatever is required excess, it will just throw it off. It has got good mechanism also. So even in vitamins, like we call as fat soluble vitamins A, D, E, K. Vitamin A, D, E, and K. These are the 4 fat soluble vitamins. Those vitamins will be stored in the liver because they get dissolved in the fat, and that can be stored. Like other vitamins, like generally people take vitamin B complex, Cobradex tablets, B capsules, all those things which contain mainly vitamin B group, vitamin B12, vitamin B6, all those things, vitamins, they are water soluble. So whatever required in the body will store. Rest all it will just get passed in the urine. That will be waste like. That mechanism is there in the body. Yeah. Yes. See, body, God has devised the body so beautifully. There are so many regulatory mechanisms. Whenever, suppose if you consume less water, kidney has a beautiful mechanism wherein it will restore more of water from your urination will be decreased. So if you consume excess of water, suppose if you consume 5 liters of water, extra water is thrown away from the kidney. So it has got beautiful mechanism, balancing mechanism. Whenever it is needed, it will retain. Whenever it's not needed, it will throw it off. So that beautiful mechanism is there. That homeostasis we call it as. That is there in each and every system of the body, that is there. So that will be taken care of. Yeah. There will be some conditions where those things are impaired. So those are the conditions where patients will suffer from excess of things like excess of vitamins or excess of calcium. Whenever those particular mechanism is not doing well in their body, that's the time they develop disease. Otherwise, normal human being, those things get balanced. Yes, sir. Yeah. Yes, Apurvaji, do you have any question?
Yes, sir. I had 4 questions.
Oh, sure.
So, first one is, My daughter, she's 3.8 years old. Okay. And your previous session, you already told us that what are calcium-rich food and easily available. So I added ragi in my lifestyle. Okay. So
Super,
we are
ma'am. That's the richest source
ragi
of calcium. Yeah.
daily. So I'm
Super.
very happy with her diet. There's no issue. But she is continuously complaining about her leg pain.
Okay.
She is very active. She is playing, and even though she is having leg pain, she is happy to play. I mean, it is if it is outside now, then she will play. But she is always complaining about leg pain. I even consulted the pediatric, but he's saying no, there's no issue. So I'm not sure whether she is asking for attention or she is really having, because every day she's complaining about leg pain. So I'm worried it is true or not.
I got your point. That's the most common complaint of children as such. Where exactly is the leg pain? Is the thigh part or is the calf part? Where is the foot? Leg means whole lower limb. Yeah.
Calf,
Exactly.
calf.
Calf, na? Yeah, that's correct. See, calf or shin, no, that's the place where the growing children will have the pain. So that's otherwise called as growing pains.
Okay.
That's called as growing pains. When the child is having excessive growth, or that's the time when the growth occurs, right? So most of the growth occurs in the body during the night time, actually. So in the children, that kind of pain will develop what is called as growing pain. That's quite normal. That's quite normal. Nothing to worry much about it. But until if it is excess or if it is associated any other symptoms like any swelling in the leg part or any fever or any of other symptoms are associated, then we need to find out what is the exact cause why the child is getting the pain. If it is just a vague pain and it increases, especially on Sundays, child will, whenever they have holidays, right, Saturday or Sundays, whenever they do excess of playing and all, so that's the time they get a lot of pain. That's the normal presentation. So if that doesn't associate with any of the significant symptoms, then this is considered as benign growing pains, and that can be just symptomatically managed. That's it. And nothing much to worry about it. Yeah, that's called as growing pains. Yeah.
And my second one is I started my calcium intake when I was lactating.
Correct.
Okay. So in between I leave that, okay, now it is not required and all that. But I got this problem, lower BP. And then I again consulted my gynec and she told me that I need calcium and I am anemic by nature.
Okay.
So I need this calcium continuously. So from December, actually, I made this motto that I would be a drug-free life. I want a drug-free life. So in December, I leave all those medication and I feel very energetic and very happy till 4 months.
Okay.
Okay. And April and May, I again started this joint, leg pain.
Okay.
Toe.
Okay.
Back
Okay.
toe. Okay. And then I took medication again for calcium for 1 month. Then I again leave it because I didn't find any problem. So what would you suggest? I should take it for 1 month and then leave it and then take it. What would you suggest?
Okay.
About?
See, your main problem is anemia, right? Anemia as well as pains.
Yes.
Okay. See, anemia.
Lower back pain.
Grade 2 pain.
Lower back pain.
Lower back pain. Okay. Lower back pain. Got it. Okay. See, anemia has nothing to do much with your calcium. Anemia is mainly iron thing. And if you are prone for anemia, there are so many conditions where people are prone for anemia. The hemoglobin level will be low, and that will produce fatigue and all those symptoms will be there. So if you are prone for anemia, you should find out what is the reason. Ideally speaking, you should consult an hematologist, not gynecologist or orthopedician. You should consider an hematologist. There are various conditions: pernicious anemia, aplastic anemia. Aplastic anemia is anemia where the bone marrow itself, where the RBCs are produced, that itself is at a fault. Then so many conditions: pernicious anemia, where vitamin B12 is less, then you will get some type of anemia. Your iron intake is less, then you'll get some type of anemia. If your protein consumption is less, you'll get some other variety of anemia. So there are so many varieties of anemia, right? So it can right from production of the WBCs and the maintenance, then distribution, then how the way it get destroyed, or any stages of that there can be problem. The reason for the anemia. So if somebody has labeled you that you're prone for anemia, definitely you need to find out what is the cause for anemia. Usually calcium deficiency doesn't cause much of anemia as such. Okay, so you need to find out what is the root cause of anemia. Consult a hematologist. If they're needed, they will do so many tests out there, blood tests, bone marrow tests, so many things. If it is required, definitely they'll ask for it, and you have to find out what is the root cause of it. Then you have to get treated. Just taking calcium and iron tonic or iron tablets doesn't help you much, because until unless the exact root cause of the anemia is found out, you won't get the proper treatment. So if you are still in young age and if you really feel you are anemic, and you're not supposed to be anemic at that age as such. So you need to talk to an hematologist and find out what exact root cause of your anemia. And if you get it, that will be a permanent treatment. And as such, calcium is also required for maintenance of physician, but it doesn't cause as such. Calcium only doesn't cause much anemic product. That's the one thing, right? That's the one thing. Second thing, yes, in lactating and pregnancy, definitely you need excess dose of calcium. Afterwards, it's not much required as such. You must be 30 plus, I think, right? What's
Right.
your 30 plus?
I'm 35.
35, okay. So backache, okay, calcium deficiency can cause backache, not that it doesn't cause. That usually causes in older age, what we call as lumbar spondylosis. That's a degenerative condition which occurs after the age of say 50 years, especially in females after the menopause. Once that menopause occurs, there is a hormone called as estrogen, which is the one which is required for the maintaining the good bone health. So that once that level decreases, that's the time when the female get the osteoporosis, especially in the menopausal age group. So 35, I don't think you will have any calcium issues as such. And back pain has several reasons. Okay, especially in your age, it will be mainly because of mechanical back pain. You need to do some exercise to strengthen your back muscles, basically. To do those exercises, that will be taken care of your back pain. Nothing to do with calcium as such. So in your age of 35, I usually don't recommend calcium tablets as such. But if you are getting if you have any specific reason, that we need to find out why you're getting the back pain. Yeah.
So actually it is not continuous. It come in cycle. Once in 3 months or like that. So it is not continuous. So I knew that I am not calcium deficient, but when it came, so I don't know what to do. So I started all those medications.
I know, I got your point. That's the common thing, especially any other non-orthopedic doctor will just blame it on calcium. That's the common practice people will do. I have seen so many patients coming to me telling their family doctor told me calcium deficiency. There are some vague answers. See, okay, there are some vague answers the consultants give. I mean, other than specialists, like they tell you are weak. They'll tell you are calcium deficiency, you have iron deficiency, you are not taking food properly, and all those things. They're all vague answers. They're not specific answers unless you consult a specific consultant and you get a proper diagnosis. Then only you can find out what the exact cause for your back pain. Calcium deficiency as such in your age shouldn't cause back pain. There could be so many other reasons, like you are overstraining the back or improper posture, or lifting the baby in itself causes back pain, right? So there's a scientific way to lift the baby. You should bend your knee joint, hip joint. You should lift so that load goes on your legs, not on your back. If you suddenly bend, see, if you just for lifting your pen paper from the floor also, you shouldn't suddenly bend from your back. Your knee should be bent. Then you should basically sit down and lift the thing. So that's a normal scientific way of lifting the weight. If you do follow all those posture things, scientific ways of doing sitting, standing, lifting weight, all those things, then you won't get the back pain. So nothing to do with your calcium at your age.
And sir, can you suggest some cortisol strengthening exercises?
Quadriceps. It's not cortisol, it's a quadriceps.
What?
It is quadriceps, Quadriceps, quadriceps. I will type if you want. Quadriceps is a muscle actually. It's a muscle in the thigh. It has got 4 heads. That's why it's called as quadriceps. Ceps means in the Greek and Latin it's head. Quadri means 4. There are one more muscle. What is called triceps? Anybody guess where is the triceps muscle? There's one more muscle called as biceps. So Agriculture, you'll be knowing where is biceps. So biceps is actually this muscle, right? It has got two heads. That's why it's called biceps. Bi means two, ceps means head. Then you have one more muscle in the back of your arm. It's called triceps, which has three heads. Similarly, in the thigh, in the anterior part of the thigh, in the front part of your thigh, you have a muscle called as quadriceps, which has four heads. So this is the main muscle which takes the load of the body, right? So if you strengthen this muscle, there are exercises to strengthen those muscles. I cannot demonstrate as such right now. Okay, I will share that also in our WhatsApp group. What are the quadriceps exercises to be done so that you will strengthen your thigh muscle so that knee joint won't get the maximum stress and strain while doing the routine activities. That I will share in the group, right? Here it is a bit difficult to demonstrate in front of the laptop. I will share in the group. That doesn't matter. Yeah.
And one more question is, everyone is talking about knee pain and joint pain, but in older age, people are having this fingers pain as well.
Yeah.
They cannot hold anything. So how to strengthen it? Can we do something for that as well?
Yes. See, actually, in the old age, what happens is called as degenerative changes, right? So especially those changes occurs in weight-bearing joints like your knee joint, ankle, and hip joint. That's a degenerative change. Yes, it can happen in especially in the thumb. This is the joint we call as most common. This is the thumb is the with the thing which is maximally used in hand. 60% work will be done by your thumb. 60% any work like we call as pinching, then hooking, then grip. All these functions we need thumb. So that's a very important. That's the reason Ekalavya was also asked to give his thumb away, not any other fingers, right? You know the story of Ekalavya, right?
Yes.
Yeah. That's the reason why thumb was asked by his Guru Dronacharya. So this is the joint which has maximum functions to be done. So this is the joint which usually goes for osteoarthritis, especially in elderly people, in elderly group. So what we can do is and that will go for stiffness also, pain, stiffness will be there. So they can keep doing this we call as range of motion exercise. They can dip their hand in water or warm water with a drop of pinch of salt in that. So they can do this exercise to produce a lot of movements in all the joints, right? So our body, God has created the joints in such a beautiful way that each and every joint should be minimally around, say, about 10 to 15 times per day should be moved to full range, right? Suppose this joint it should be moved for about 10 to 15 times to its full range of movements. If you don't do it, it will gradually go for stiffness. Since there are some people who never sit on cross-legged and never sit on the floor. If that's the case, the knee joint won't go into the full function at all, right? So your normal joint should be moved about minimum 10 to 15 times per day throughout its normal range of motion. So elderly people, they can dip their hand in lukewarm water, put 1 spoon or 1 or 2 spoon of salt, and they can do this exercise. So that will produce the full range of movements of the joints, and that will take away any stiffness in the joint, and that will improve the blood circulation to the joint, and that will strengthen the muscles also. The muscles which are doing this kind of work, then that will get strengthened. So they have to do those range of motion exercises, and painkillers only if it is needed. Otherwise not. Then they can take calcium-rich diet and do those exercises. That's it. Yeah. And hand joints usually don't go for degeneration unless there is one more condition called rheumatoid arthritis. That's the condition where most commonly your hand joints will get affected, especially your proximal interference joint and metacarpal joint. These are joints will get PAP. This is a DAP, distal interference joint. This is the proximal joint. This is the metacarpal MCP joint, metacarpophalangeal joints. These joints get affected in a condition called as rheumatoid arthritis. That's actually a different kind of disease that needs to be handled in different way.
Okay.
Yeah.
Thank you, sir. Thank you so much.
Welcome.
Sir, Dhananjay sir sent one message, sir, actually. Of course, I got questions. Next session, I'll ask my questions. Dhananjay sir sent one message. Lower back pain when after getting up from bed.
Lower back pain in the morning when I get up. Do I need to do any exercises? Okay. Is Dhananjay sir is there? Sir, are you there? Dhananjay sir? Because can you give me some details? I mean, do you get it regularly or on and off?
No, regularly. In the morning only when I get up, I feel a back pain. And after maybe 2-3 hours, when I started my daily routine, after that it subsides.
Correct. Got it.
So after that, no problem till the night when I go to bed.
Yeah.
Only in the morning maybe first 2 hours I feel that. That's
Okay.
all.
Since how long, sir?
It is since I can say maybe 2 years.
Oh, 2 years. Your age is 40 plus, is it?
Yeah, it is 47.
47. Okay. 2 years is a quite long period. We are not supposed to neglect the pain which is there for 2 years, right? There's a cutoff point is 3 months. Any
Okay.
pain which is up to 3 months, we call it as acute pain. Any
Yeah.
pain which goes behind 3 months, we call it as chronic pain.
Yes.
Right? So once it is become 2 years means definitely is a chronic pain. If it is two years, we need to find out what is the exact cause of it.
Yes.
Also at times early morning pain, early morning if there are so many conditions, most common is what's called as ankylosing spondylitis. So we need to find out what's the problem. There is one joint called a sacroiliac joint in the lower back, especially.
Okay.
So there are some conditions which will affect that sacroiliac joint, or a sacroiliitis. And especially see, normally whenever you have excess strain, we call this mechanical back pain. Suppose you have ride a bike for a long distance, or you are sitting for long duration, whenever, or you are lifted heavy weight, there you will get pain. What is called as mechanical back pain.
Right.
Those are the back pain which should reduce after taking rest, right? So
Yes.
most of the back pains they will reduce after you taking rest. If you lay down for an hour or so, or if you take a good rest throughout the night, morning that pain should go off.
Yes.
That's a normal pain. You don't have to worry much about it. That was because of stress pain was there. But if the pain increases after taking the rest, like in your case, when you are sleeping peacefully in the night and morning when you get up, you have the pain.
Yes.
So those are the pain which needs to be evaluated, especially if they have caused a period of three months.
Yes.
What I suggest is you can get done one X-ray basically. Pelvis, they take LS, lumosacral spine, AP and lateral view, and they'll find out any changes in the sacroiliac joint as such.
Yes.
Yeah.
Okay.
So sacroiliitis can cause this kind of problem. So we need to find out what is the exact problem for your problem. And if sometimes it may be normal also, if it doesn't have any much problem, then they need to do some back care extension exercise also. With that, they should be happy with that.
Yeah. Okay.
But
Thank
take
you.
basic investigation like on X-ray of the lumbosacral.
Yeah. Okay. Good.
Yeah.
Sir, one generic question. Sometimes for the pain, they apply ice pack, sometimes hard pack. I mean, when to use which pack?
Okay, that's a good question, sir. There's a lot of things. Yeah. Other day I received one patient when she had injured her great toe. She had put a lot of salt. I mean, they eat up the rock salt, no? With that they will give. See, whenever there's acute injury, right? Whenever there's acute injury like your sprain of the ankle joint, whether somebody hit you or you hit your wall or any other furniture or something, whenever it's an acute injury, there is pain and inflammatory things get released at that particular part. So that is the time when you want the pain and swelling to reduce. That is the time you should give what is called as cold packs. You can either dip a cloth in the cold water and just wrap around that particular part, or you can use plastic cover full of ice cubes. Okay, so cold packs should be given in acute injuries whenever there's increased pain, swelling, inflammation, acute injuries, and hard packs should be given in old injuries like chronic pain. Suppose if you have injured your ankle joints about 4 weeks back or 1 month back, and then still the pain is continuing. That's the time you give hard packs. Cold packs in acute injuries, and hard packs in the old type of pain, chronic pains like your low back pain is a chronic pain. There's a history of injury or something like that. Then you can use your hot water packs. Cold packs should be basically for acute injuries.
Okay. Yeah.
The patient which I discussed, she had a great toe injury. She hit while taking bus, she fell down in the bathroom and her great toe hit the wall. So there was a fracture. She started pouring hot water and giving hot thing. And after giving those things, her swelling and pain increased. She started having blood salts that got infected and a lot of problems were there. She was a diabetic patient. So whenever there's acute injury, you should give cold packs. That will reduce your pain and swelling. That's the thing.
Okay. Thank you.
Yeah. And you shouldn't never ever rub it. See what happens whenever the children fall, right? So suppose if they fall and if they sustain injury, the immediate thing, see what happens. I must tell you, especially if, after seeing this media, let it be serials or your movies, no, whatever they show, those things will be there embedded in our brain, because from the childhood we have seen those things only. Like whenever somebody falls, suppose a child falls, if he sustains some head injury, they'll come and start rubbing it like that. Shouldn't rub. You should not rub at all. If you rub, the pain and inflammation will increase. The pain will increase rather. You're not supposed to rub that. Okay. You're supposed to just, you can give some cold packs or something like that. So see, these are the patterns which we have learned from looking into our TV and other medias like your film or those things. That's the common thing, no? Whenever a child falls, mother will rush and she start rubbing and doing all those things. Rubbing and all those things should be done at all. So what it needs is rest. You should give some cold packs and see that the pain and swelling will come down. Yeah.
Very new, sir. I was thinking that rubbing will help in the circulation of blood and then heal, something like that. That's what.
No. See, in acute injury, there is already pain and inflammation. There's excess of blood flow coming there.
Okay.
So if you do all those things at acute pain, that will increase.
Okay.
Whenever there's pain, you should see that the particular body is rested, given adequate rest, and blood circulation should reduce at that point. That's acute injuries, especially say about 24 to 48 hours. There is increase of blood flow there. Pain and swelling will increase, everything will increase actually. So that's the time you should see that the blood flow will decrease. That we don't want any pain and swelling to increase. So acute injuries, you should give cold packs only. That will produce what's called as vasospasm. So that will reduce the blood flow to that particular point. That's in case of acute injury. In the old injuries, there we want excess of blood flow and healing to happen. So that's the time you give hot water, all those things. Yeah. Yeah.
Thank you.
That's the thing. Yeah.
Thank you, sir.
That's the only second thing in the films also you might have seen, especially when somebody, some head injury occurs in there is some accident, no? So whenever there is patient is fallen unconsciously, people just start pouring water into their mouth. Hey, bring water. Just splashing on the face, it's okay, but you shouldn't make them drink the water, because patient is in unconscious state or in a subconscious state wherein he is not able to, his reflexes are not working properly. So if you make them drink water, that will enter the lungs. That is what's called aspiration. So that shouldn't happen. So when the patient is partially conscious, is not well awake, no, you're not supposed to make them drink any water or anything like that. No, you're not supposed to. That will, instead of going to the stomach, it will go into lungs. So that shouldn't happen. So these are the things which you all, from the childhood we have seen in the movies and all this. That's got embedded in our brain. So even our parents will start doing that. Your relatives, friends, everybody is doing that. You also start doing that. That's not a correct way. Yeah.
Sir, I think you need to post it on social media, because these are very common mistakes we do.
I know. Yeah, I'll start doing those, madam, actually. So what I was saying, initially, being an orthopedic surgeon, I was concentrating only on my orthopedic topic. I have made nearly more than, right now it's nearly 200 videos. I was doing only on the orthopedics. As you suggested, so many patients also, while writing their comments also, they started telling that you should make video on these things also. Now I have slowly started doing that, because some see, to be open with you, to be frank with you, my own colleagues are started, you're orthopedic surgeon, why you're talking all those things? Let the general people talk, it's not your subject, you're wasting your time, all those things. But I thought, okay, as a social concern, as giving something to the society, giving back. Now I realize the issue, and even I should do all those videos. Short videos also I've started doing. I will do that, madam. Thanks for that suggestion. Thank you. I'll take it up. Yeah.
You can just talk about the do's and the don'ts, the common do's and the don'ts that we do, so address.
Yeah. Correct, madam. Got your point. I will do that. Definitely I will do that. I will take it up. Yeah. Thanks for the session. Yeah.